things. It is our spiritual well-being. It is our mental well-being. It is a part of our physical well-being. It is the combination of our emotions and our thoughts and how we feel and how we experience the world. And so we know that our mental health overall is pulling from all of these different things, and all of these different things can affect it. And so it's so important to be mindful of the different components of what, brings together what mental health is, so that we can tend to those different things and make sure that we're promoting good mental health and healthy, positive mental health. So, yeah.
In the mental health world, post COVID-19?
Like going into the pandemic, during the pandemic, after the pandemic, and I would say post pandemic, I would say that there's been a lot of studies and research into like how did the pandemic affect people, how did COVID-19 affect people, and we saw there was a significant increase in anxiety, depression, just with the isolation, with the loss of connection and community, with the tragedy of losing people who were close to you, the loss of routine and activities that were bringing us out and about and brought us joy. We saw a lot of people who became more depressed, more anxious, started exhibiting symptoms of PTSD. People who had already gone into the pandemic, an exacerbation of their mental health concerns. It was just so many different things. It's like this ongoing ripple effect that we won't be able to really grasp until we kind of a couple of years out, and we can really see what happened. But what we can tell now is that a lot of people are suffering. A lot of people are having a hard time. But a bright side I think that I saw was that people a lot more people became in tune with that and started talking about their mental health a little bit more. With the shift into everything being virtual, prior to, we had to have mental health professionals, there's special training, you have to be certified to do telehealth, and then all of a sudden it's like, well, this is the only way people are getting therapy. All y'all to the laptops, and so we saw a lot more people actually get access to care, because now all you have to do is log into your phone or log into your laptop. And like where I work, you're taking the data on that, and they're like, okay, we're seeing an increase in people showing up for their appointments because now they can pop into their car and just log in, press a button, and they're there. So there's a lot of cons, of course, a lot of just difficult, tragic things that came out of the pandemic as it relates to mental health. But I've seen also some positives, I guess, of how people have been able to connect in different ways. We had to learn how to adapt. So we built community in different ways too. And how do we survive this? So that's a bunch of things.
The intersectionality between mental health and modern medicine, people sometimes see them as separate things, or like they look at them from a place of isolation. And there are several people in this space who are interested in medicine in particular, and then we also have public health. And I see all of those things as divinely connected. However, on paper, oftentimes when you're talking about like rules and regulatory, looking at like grant funding and things like that, they are seen as separate entities. Right. And I would love for you to chime in and share about like your thoughts around like why there may be division amongst like medical professionals, mental health professionals, public health professionals. And I know that you are a public health expert as well. Oh, so are you. I just want to like invite some thoughts about that, because that's challenging for me to see them as separate entities.
How we're feeling in our body can affect how we're feeling mentally, like how we are engaging in the world can affect our bodies, When we talk about it at a public health level, like when we're thinking about, for example, suicide rates and the increase in suicide rates amongst Black youth. That's a public health concern, like how do we address that? What's going on in the different aspects of our different facets of our community that are either contributing to that or can help act as buffers between that, experience for folks? there's so many ways that we can make those connections and draw the lines between the dots. And I think as professionals in our respective fields, we just have to continue to have conversations and connect with each other. There are no hierarchies here. We all are valuable in our own special way. Like, my lane is clinical psychology, but I am no more important or no more special than the public health expert or the psychiatrist. They're no more important than me. We all have to work together. I love working in interdisciplinary and multidisciplinary spaces because everyone gets to bring that expertise in to help work on, like, say for an individual, you have a team of people. My psychiatrist who works with not my psychiatrist, but many of my patients, their psychiatrist is across the hall from me at my job. And that is a phone call away, an email away, a Teams message away. And we work collaboratively because we know that what we bring to the table, all of those things are instrumental in helping that person get well. And we just have to continue to do that. Research shows that the combination of therapy and medication is like the wombo combo. You know, they can be very effective on their own, but together, in instances where medication is required or therapy would be a necessity, let's do it together because we know that this person's wellness, we can approach it from different ways. So
in reality, that's not what it is. It's more like, how does the person's body translate to their health? You can't be healthy if you're not healthy mentally, physically, and spiritually. You just got one of them. And it's like, it's like playing Monopoly. You only got one property and everybody else got all. Not the same relation, but if you will, like, I feel like the disconnect always is gonna be because people don't know how to express their emotions, number one, through mental health. They don't seek therapy, they don't know how to have proactive conversations. It all kind of ties into one. And then when you think about the public health aspect, which I was sharing with my interns earlier, it's all about what you eat too. Like, the food that you're consuming affects your brain, which directly affects the way you react to things, right? So how you get up every day, how you carry yourself, how you think about things. Like, that's all a part of the mental, which is a part of the spiritual, which is a part of the physical. So, but that's just my take, right? That's just how I see it. I know everybody else have their different opinions.
I just been seeing, a lot of people have cancer, like rectal cancer, all that great stuff. But I feel like they're taking more of a stance on the holistic approach to medicine. So instead of treating, like, with chemo, with radiation, they're actually, like, allowing patients, like, just recently my grandfather, he was diagnosed with colon cancer. And instead of, like, giving him the option of just, like, chemo or radiation, like, they allow for him to, do holistic approaches like meditation, just simple stuff, so you don't have to put your body and your mind through that turmoil because you're already going through a lot just with the disease itself. So I like that with the medicine just evolving a little bit to allow for, minorities or people who don't really have that option for holistic approaches in their, like, regular life. They're allowing that change to occur through their, like, their pain and suffering during the time. So.
And that's amazing. If you haven't seen Heal on Amazon Prime, I highly recommend checking it out. It's basically talking about the development in modern medicine to create more space for holistic healing practices, such as, like, the breath work and meditation. And in that documentary, one of the spiritualists said that, like, breath is so important to well-being. And oftentimes when you think about stress is the number one causer and killer and, like, creates disease in the body. And oftentimes people aren't breathing. And so, like, that intentional breath can actually be part of the preventative work, which falls up under the lines of public health, but it can also be a form of treatment because there was a lady in the documentary that was doing the breath work while also going to see her therapist, and she did one round of chemo or radiation. No, one round of chemo, and the cancer cell disappeared completely. And the doctor said they've never seen a cancer cell shrink so quickly and disappear. And it was this idea that, like, it takes a multitude of approaches to solve the problem, and with those continuous efforts of, like, breath work, that spiritual hygiene is what I like to call it. Like, what is your spiritual hygiene? Do you intentionally breathe? Do you intentionally create that space for meditation, yoga, chakra balancing, coupling that with your therapy, coupling that with your checkups, you can actually push yourself to have a long and healthy life.
Like, you know, medicine and public health, I just hope to see like a relationship form between the two, because you're a biology major, right? And did you have a public health minor? Did you take in public health class?
Like with the biology courses, they didn't pair us with public health.
That doesn't make sense, especially at Xavier. I feel like if you're going to go into pre-med, you need to take public health classes, like the socio-ecological model, like where you live, where you eat, where you play, where you live, like that all has an effect on your health. So taking all those into consideration when you're creating a wellness plan for your patient is important. And I just feel like there are doctors who really, really care about their patients, but there are some. I took a health management class. The hospital medicine field is like the biggest corporation, the biggest, like they make the most money, like, and their focus is to make money. So they're not thinking about the prevention. They're thinking about, okay, she has cancer, let's cure it and then be done. Like they're not thinking about anything else. So I just feel like that's something I'm super passionate about and hope to try to change.
Well, may the universe grant you the like space and the energy to be that catalyst, because like obviously, you know, we all see the disconnect and we experience it, and I think you see it firsthand when you have a loved one that is going through some type of terminal illness, like my grandfather who was experiencing cancer, and like having to go to all these different practitioners, and it's like, but why aren't y'all talking to each other?
And like,
and like, why is there a collective shared file, some type of system that allows you to access, like, this is how this person is being treated from like a medical perspective, this is the implications on the public health perspective, this is the holistic approaches. Like, where's that system that allows us to tap into like the connection between all the energies?
And I love that you said that your colleague was right down the hall. Like you said, I feel like there needs to be more clinics where there's the OBGYN, the therapist, the pediatrician, the dentist, all in one space, so that people can, you know.
Come on, medical house. That might, baby, listen. Y'all know we love a good house. I'm like
in Chicago.
Dream house, medical house.
There you go.
The medical house. Thank you. Okay. Maya, you writing that down?
She got her pen in her hand.
Listen, brand and development strategist.
She got her pen in her hand. One stop shop. That would be beautiful.
That's my dream for like the brand stuff.
Yeah, one stop shop.
Yeah.
That would be great.
That is actually a really great idea. And
Yeah.
somehow we need to pitch, write a grant collectively. We want to create, there's 1 million abandoned buildings in New Orleans. One of these buildings, we can just create a one-stop shop. You get every service that you need. Let's get it back. We taking a field trip to
Maybe like same day, same week too, because how many times you have to like
Go
to a general practitioner and then have to go see a cardiologist and then be like, now you have to wait 3 weeks, and it's just like, I've been fainting for a whole week. What would I do?
Or I have to take an Uber to go to the doctor.
Right.
transportation.
My question for you guys would be, when it comes to sexual and reproductive health, how do you see your work in the midst of that, right? So when it comes to mental health, do you see patients who come in with these crazy diagnoses and they don't know how to deal with it? How do you help them? What resources do you provide to them?
It's a layered question.
I know.
Trying to think of my answer.
Gotta give you an idea.
No. I mean, yeah, I've seen a range of different diagnoses. I haven't had someone recently come in with concerns around like reproductive health, but I'm just keeping that in mind, because as like the landscape of access to that changes, we're going to start seeing a lot more people coming in distress about that in particular, and then it might be exacerbating other mental health concerns that they have, other diagnoses that they may have, and so excuse me, we're having to get really creative of how do we support people in those spaces, because a lot of it now boils down to mutual aid and helping them know, where are the funds so that you can travel to get your abortion if you need it, or if you are out of that option, if that's not even an option for you, how do we support you and connect you to resources for when that child comes and those sorts of things? Because I think one of the things that has been the most challenging about being in the mental health field and being in psychology is that I can't therapize you out of systemic issues and oppression. There is nothing that I can do that is going to decrease your rent, make food more accessible, get you the child care you need. And that's so much of what I see, especially in a space where I'm seeing predominantly Medicaid. You know, like there's so many things happening in your environment that I am just trying to help you cope with that. And so I think what we can do as mental health professionals is continue, of course, to be on top of what's happening around us. We need to be clued into like what's happening, you know, politically, what's happening at the, not just at the federal level, but state level, local level. What are people doing to support our communities, the people who come into our offices? And then from there, use the skills that we've acquired in our training to help support people and help them navigate that. I'm CBT oriented therapist, cognitive behavioral therapy, which looks at how we think and perceive situations and how that impacts our mental health and how we feel and how we behave. And full transparency, a lot of people do not like CBT for Black people because they're just like, how do you change the way somebody thinks about something that is just like, that is how they feel is legit. But I take the approach that I am not trying to change your thinking or to give you silver linings when there is, you know, some things that we cannot change in your environment. What I'm trying to do is look at how we can possibly expand it so that maybe we're not catastrophizing. Maybe because of the way we're thinking about the situation, we might not recognize some other options or support networks and systems that we have in place to support us and help us. And in the meantime, I'm not social work, but sometimes I feel like I have to put on a social work hat real quick and it's like, let me get on my laptop. I'm about to find you every resource that I can. I'm gonna connect you with the son. I called to help one of my patients get registered for a Nord summer camp one time to be on 3-way because mom is functionally like illiterate. She can't read. So I'm just like, okay, yeah, we just gotta tap in and know what's going on, know your patient's situation, meet them where they are, use your therapy skills, but also just use your human skills to be able to show up for that person. So yeah, that's what working in community mental health is like, but it's amazing. I love it. So did I answer you?
Yeah. I was gonna open it up to Dr. Bill or
It's Saturday. I could be taking a nap day, but I'm here with y'all. Now you want me to talk? Great question. So Kaita Mutapfa, I'm with Gilead Sciences, and oftentimes, you know, when you are a Black person that work in corporate, there's always, you always feel this kind of tug and pull, right? You know, because you want to be with the community, but then you also see the tremendous opportunity that corporate side yields. And so I work in HIV, human immunodeficiency virus, and I love to share with people that I feel like HIV is a proxy for what you just talked about. When you think about HIV is the only chronic manageable disease, not system. So Medicaid and Medicare is a system, right? Social service or social support system. But HIV as a disease state is the only chronic manageable disease that has a federal allocation, which means every 5 years, Congress votes how many millions or billions they will give to HIV across the United States. And they do that work because of the Ryan White CARE Act. And so some of us remember Ryan White that grew up in the 80s, but Ryan White was a young boy who, a white young boy from the Midwest, had acquired HIV through a blood transfusion when we did not have the sophistication of the test to find out if HIV existed in the blood. He acquired it, of course, devastation, eventually had AIDS, eventually passed away. What was beautiful about Ryan White is if you Google Ryan White on Netflix, Hulu, Prime, HBO, you'll see documentaries. Some of us still remember that time. His mom is still alive talking about it. But what was beautiful about Ryan White is he wanted to do everything that y'all were just talking about in terms of what a human being should have access to. He just wanted to play. I remember one video, someone, asked him, a reporter, why are you doing all this? I just want to play with my friends and not have stigma. So as a result of this one family's commitment to do everything that you always talked about, you start to see these like small efforts build over time, right? And so when you think about the Ryan White Care Act, Ryan White was not queer. He did not acquire HIV through behavioral sex. He acquired it through no fault of his own, right? And so fast forward now to 2024, HIV, like I said, in my opinion, is a beautiful proxy of what can happen when you have the interplay of federal systems that provide the funding, and the funding has been for decades now. And then that funding then rolls down to states, and then that rolls down to cities, and then that creates things like housing. For HIV, if you're a person living with HIV in the city of New Orleans, you qualify for housing assistance, barrier removed. If you're a person living with HIV in New Orleans and you need transportation support to get to the doctor, let's call it Uber, barrier removed. If you need childcare, here in New Orleans, they used to have a clinic called Faces, and Faces was just for women living with HIV. You could go there, you walk in, someone took your baby, and then it would be like a one-stop shop. You would go see the therapist, you would go see the blah, 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 you would go see the doctor, and all of that, get your food back, and then eventually leave. They were able to create those systems, but they had the funding. And it wasn't grant supported, it was federal supported. And so a lot of times with HIV, what we were able to do in HIV is we insisted and made it a priority. We didn't wait for someone else to make it a priority. We insisted and made it a priority. And so at Gilead existed. Gilead didn't exist when the epidemic first started. Gilead is only about 3 decades old. HIV is about 44 years old. Right? So that's like close to some people's age in here. I'm 49, so right? And the consistency over time. And so I wholly believe in what you're saying and what is being proposed, because it's definitely what Dr. Baptiste said, it is definitely needed. But I say use HIV as a proxy to see where were we when it started coming to stigma, right? Because when you start looking at communities that were so vastly impacted, from Black communities to queer communities to women, and here in New Orleans, some of y'all may know in public health, and that we have 2 simultaneous issues happening right now. One, according to Dr. Tavell Kendall over at St. Thomas, in 2022, we saw the highest number of Black women being diagnosed with HIV in the state of Louisiana. Why? It's not because of the down low, which we don't ascribe to that, but it's a ripple effect, right? A ripple effect. The second thing that we're gravely impacted by in the state of Louisiana, for all my public health folks, is STI, sexually transmitted infections. Syphilis, gonorrhea, chlamydia, and trichomonas. Syphilis in particular, at one point, I think in last year, had a 200% increase in congenital syphilis. Am I right, Tamia?
I mean, in Detroit, that's a major problem in Detroit right now.
Yeah.
And I was like, syphilis. I ain't heard that since Tuskegee.
And so what's crazy is that when we don't take care of something or pay attention to something or be intentional about something, then it comes right back. Because during Tuskegee, we weren't provided with the intervention and the help to do something. And then populations and generations and families were dismantled. Now in 2024, we're starting to see something similar, but we have all of the interventions we need. The biggest thing that's missing is the education. the biggest thing right now is the education and just the willingness for people to accept, you know what, let me just talk to my doctor about this. Let me just raise it. Look, you know, let me just go get me an annual instead of YouTube. Instead of and please stay off of WebMD. Like, just go to a real Dr. Baptiste or a real Dr. So-and-so, right? Or even at Ochsner for Infectious Disease. Like, talk to a real human and ask, you know what, just check me for everything. I may not have done anything lately, but I might want to do something, and I used to do something. But I think a lot of times if we do not pay attention to things, Dr. David, we're going to continue to keep seeing it coming up.
And I like the way that you frame it, like, let me just go check. I think that there is a lot of, obviously there's a lot of things that we have to work on.
I'm sorry.
Like, there's a lot of things that we have to work on in our community. When I zoom in and look at Black and brown people, there's this like pride, and so it like inhibits us from talking about how we're experiencing life, particularly when it comes to things like STIs or any like types of diseases. Even like your side can be hurting and you won't say anything because you just want to be resilient and like suck it up, but your side hurting can be indicative of like a tumor growth in your side, and you wait until it's at stage 4 and it's like, oh well, I done had this pain for over a year. And so I think, you know, what's coming up is like we gotta like push the education. I agree. And I'm wondering, how is it possible for us to provide space for conversation around the medical mistrust and distrust that occurs? Because a lot of our people ain't saying nothing because generationally we have gotten the short end of the stick. And so it's like, well, why say anything? Address the mistrust in the system at large.
I say bring people together and have them talk. I feel like Dream House is the perfect place.
Thank you.
It's the perfect place for a lot of reasons. I was sharing that with you earlier. Like, one, you come in first. I think Delise and I were talking earlier. You know, when you stand on the shoulders of Miss D, who, what a lot of people don't know, pre-COVID, this used to be a coffee shop owned by a Black woman who never told people that she was the owner. And so the judges and lawyers and stuff would come from down the street through here, get their coffee and stuff, and go on. They probably thought she just worked behind the counter. And after COVID, during COVID, she didn't make it. And then afterwards, transition out. And now Dr. David gets to like be in this space unapologetically Black. Unapologetically Black. And I feel like that right there is how you bring people in and start inviting them to have conversations. Like, let's just talk.
Yeah.
Do you know that people in medical school get like 4, I think the max is 4 hours of HIV education? Let's just start talking. And that's what y'all, Dr. Baptiste does that on Wellness Wednesdays. I mean, but it's like, it's creating this domino after a while, right? And of course, not ascribing or subscribing to a particular system or, I mean, because we all have our own like reservations about all of that. And our ancestors died for us to have access to it too. Because those that didn't get the medicine during the Tuskegee experiment, yeah, that was a decision that someone made. How can we make a different decision?
I think I would add to, you know, validating that anxiety, that real, you know, it's like, it's not pathological paranoia that you're experiencing. I don't have to, you know, say, oh, no, you shouldn't feel this way about doctors, because it's legitimate that you have a concern, because to your point, yeah, we have been mistreated, we have been abused, we have died at the hands of people's neglect. And so it makes sense that you come in with your reservations. And so I think in validating that reality, validating that that is a part of our history, and we're trying to do our very best, especially those of us who, you know, like we're Black too, and we work in these systems and these spaces. Now that you mistrust, what is our responsibility to help you and do what we can do to, you know, support you. And so I think that that's important too, because if we come at it immediately with this isn't how you should feel, that can then reinforce that idea or those beliefs that you have about it. Because it's like, oh, you're just sucked into the system too. Why are you invalidating what I know to be true? So no, let's say like, yeah, no, that did happen. But let me tell you about what we're doing differently. Let me tell you about what I do differently, because we still have work to do. So, you know, like this is how we're going to approach this conversation, because we have to also think about like the anxiety, the real anxiety about finding out if you have an STI or if you have HIV. But to your point about education and having conversations in spaces where people can feel safe about having those conversations. It's like, first, yeah, let's validate your experience. Also, let's educate you. Let's tell you about all of these medications. Like I learned so much. I knew about PrEP, but when I heard about like, was it PEP and then DPEP and like all of these different, and like that people just did not know about. And we made sure to spread like everything we took from that conversation. I'm like, all y'all, this is for everybody. And so you continue just to educate them in spaces where they feel validated and heard. And that anxiety, you know, we can kind of reduce that by, because a lot of anxiety is about just the unknown. You're anxious because you don't have the answer to it. Well, let me tell you what I know about it so that you can feel a little bit more secure in what's going on. And boom, now we can reason, you know, have reasonable levels of anxiety, because anxiety is not a bad thing. It's real. It's just when it gets out of control, it comes to you. So, but I think that would be my response to that too, because we have to let people know that it's safe to go to the doctor. And it's also cool to say, hey, if my doctor is not for me, somebody help me find somebody new, because this white man not listening. And that has happened. And it's just like, okay, cool. That's fine.
Not you calling the people out.
Pleasure. It's called pleasure. Pleasure principle.
You know? It ain't nothing wrong with that, right? But what tips, what advice would you give to somebody, for instance, like our college students, and y'all can chime in if y'all want to too, about learning about maybe your first STI and you've never had this before and you're freaking out. Maybe you encounter somebody, you don't know if they got, y'all didn't get tested, y'all didn't go about it the right way. What advice, or how would you tell them to navigate a situation like that?
I would say that first and foremost, like the great point here, going to the doctor and getting a full panel, run everything, right? So that you can be in the know about what's going on in your body. And then the next thing is that if you need support in learning how to have a conversation about that with a partner, or how do I tell someone that I have an STI and they may need to go and get checked, I would say tapping into the resources that are available to you on campus. A lot of people I know, Xavier, Dillard's the same too, where the counseling resources may not be utilized as much as they can be. And so they're there for all kinds of things that they can support. Go in and talk to them. Talk about your fears about what's going on and how do you do this and how can I bring this person in with me? Can you help facilitate this conversation? Because I'm scared. You know, like you can ask for that permissions and we can sign off on all the things. So like, you know, loop somebody into your care and that kind of stuff. But I think that that's really important too, is that people feel like they have to approach it alone. STIs can feel very isolating. What we can do as therapists is to help people to kind of pop that bubble and say it's not just you. There are thousands upon thousands of people who are living with STIs, surviving with STIs, getting their STIs cured. So we pop that bubble, we let you know it's not just you, we give you some confidence and how to be able to approach this conversation. We can support you in those conversations. So I think that's important. And then I think the schools honestly can even do better with the kinds of events and conversations they have about this, because it's like during homecoming, there needs to already just have the bus ready, pull it up. Do you need to go get your blood work done? It's right there on the bring the bus every time you have a big event on campus. They need to be there, because some people are just, I don't know who to call. I'm out of state. I'm not with my primary care person. Who do I go to? There just needs to be more conversations, and this is like the public health thing. Like, how do the primary, and then we can get into the secondary and tertiary levels of care. But, like this is that first kind of stop that they can have where the counselors have them set up out there, have the bus set up out there, but let people know where their resources are so that they can feel supported. And then help give them the language too if they're not really sure of how to do it. Help them with that, because that can be a very scary conversation. And you might have a very, not pleasant reaction by the person. That could be real.
Not by text message. Like, hey,
don't do it by text message. But also, if you have concerns about how that person may react to that, that's a valid concern. Again, that's where we tap into our resources of how do we do this, because I need to communicate. If it needs to be a phone call, can I do it while my therapist is here? Let's do it during the session so I can call that person and you can support me after I've had that conversation. There's a whole bunch of things we can do in session. So
I was gonna say, really quickly, I would like to shout out Dillard, your alma mater, because this morning before I came here, the Sigma Gamma Rho sorority, their chapter at Dillard is doing some amazing stuff around Black women in prep. And so on Tuesday, February 27th, they're going to have a Black women in prep conversation. And the students at Dillard were talking about how to get their peers involved. So we were just popcorning this morning about different activities. And it was beautiful to see, like, I think I was telling Dr. David about 70% of them were going into public health, nursing, biology. So it was beautiful for them to see and to be reminded that your peers are one day going to be your patients. And because of that, how can you build up your skill set now, getting really comfortable? Let's talk about it. Because the thing is, publicly, no one may know what the STI rates are on Dillard's campus. But within the dorms, y'all know. Y'all know who is doing who, right? And we started talking about sexual networks. And I asked the question about sexual networks. I asked the question about sexual networks because a lot of times with sexual networks, and that's what we do at Gilead, we want to get you thinking. And so I asked one young person, I said, what's a sexual network? And she was like, oh, swingers. And I was like, yeah, let's draw it back a little bit more. And then someone else said something else. And I was like, is Dillard a sexual network? I said, a sexual network is simply where you are and who you have sex with. And I was like, is Xavier a sexual network? Yes. Is New Orleans a sexual network? Yes. East Bank, West Bank, Uptown, right? Gentilly. And sometimes your sexual network, you might be like, okay, Gentilly, I can only do a River Ridge. Or I can only do a Shreveport and a Baton Rouge, Our sexual network becomes those who we are connected to. And you see someone else and you might just be like, oh, so-and-so's with so-and-so. Right? Remember that at Dillard back in the day?
I would watch how
freshman
many people
year
go to the gardens and come.
Yeah.
Look, the girls outnumbered the guys when I was a freshman that year. And it's just like, oh, I know the sexual.
Yes. And we're all kind of caught up in it. Yeah. Right? And especially if you're that student that moves off campus, you might think you're exempt. And it's just because don't nobody see who's coming to your network. Because it is membership only. Touche. It is membership only. Meaning no one knows what you're doing.
You did it.
I know.
But yeah, I'm like,
I never hear you speechless. I never ever hear you speechless like a like sexual. And I feel like that's it right there. If you start talking about sexual networks, then we start to break down
a lot of stuff.
Go back to this book.
Why are we going to purpose?
Yeah, I had a question. What would it take to build a system similar to what we had during COVID to help accommodate for people's desire to be private about maybe having an STI, to where maybe it's like an anonymous text message system where you list the number of people that you may have slept with over the past, several months, that, may have been exposed, and then they just receive a message from an app or something like that, to where it's like, hey, you may have been exposed to this STI.
New York has that.
They have that?
I have been on the receiving end on one of those text messages one day, and it was like devastating. So I don't know that it's like the best way, but New York, when I lived in New York, I've received a text message before from like a government. It was like a doctor's office, and it was like someone tested positive. They did not want to like reveal themselves. We recommend you come in and get tested. And I like went in and got tested. So I do think that there's versions of those systems that
Disease
exist.
intervention specialists.
They call what?
They call them disease intervention specialists.
Oh, okay. So they do have them here.
Mm-hmm.
Oh.
And it may be more personalized.
Gotcha.
Where the person will try to come and find you.
Gotcha.
But to your point, it seems like you're delving into the anonymity aspect of it, the privacy aspect of it, where people can still live and breathe and do what they want to do and still have that kind of sanctity of keeping it within. That's a great question. Knowing your brilliant mind, you probably gonna come up with something how to fix that. That's a really great question. Because one thing that we saw in my side of public health is that those sexual networks were on and popping during COVID. On and popping.
Yeah. And is that because of the isolation and the loneliness?
No, it was just like no. I don't know. Dr. Baptiste might have a different insight. I think for some of us, it was like, listen, I'm at the house. I'm still gonna get paid. I'm just gonna go. And I haven't been to church since Easter 20 years ago. So if I'm gonna go out swinging. Literally.
No, seriously. And some people, you know, like if you were in, I would say this is no research backed thing. This is my own working theory about the isolation piece though. But like if your loneliness is like hitting a peak and you get a text message from somebody where in any other circumstance you might not, but at this point now I'm just like, I'm touch deprived, I'm bored, I have nothing else to do. What's 1 hour with this person at their house or whatever? Like, what, you know, who's gonna see me creeping up the street? You know, ain't nobody is outside. No one is outside.
And I'm gonna be in a mask and a burqa. And
no one's going to see me. The walk of shame, what shame?
Yeah,
There is no shame.
You just start coughing and everybody
just
like
back up. But yeah, it's a combination of things of how that boomed because to a point, like a lot of people were inside and you had the time and you had the space and you could just go forth and do whatever it is that you have to do. Interesting times.
And then they also did it without shame. Y'all saw that.
Yeah.
People did it without you were living and in HIV, we would still see people coming to STI clinics to get tested. Right. So it's like they were extremely responsible.
Yeah.
But it was like, I'm going to take advantage of this is,
Questions from our current students about mental health with COVID-19 and we've been rolling. I'm sorry.
No, you're fine. I've been enjoying it. It's okay. I'm good. I'm good.
I have a quick kind of question, or you don't? Oh, okay. So when I think about like having reproductive and sexual health conversations with like college students or the youth, I don't know. I just feel like some people just shy away from like joining those type of conversations. I don't know. And I was in LA this past summer and I went to this reproductive justice conference with Black Women for Wellness. I don't know if y'all heard of them.
With Jan and the crew.
Yes. So it was amazing. It wasn't just about, okay, there are these stats about, maternal and child health or, wear a condom or do things like that. But we talked about, one session was about womb health. And that's something that I went to OBGYN a couple months ago and I was like, can I have children? Like, can you find that out? Can you know that? And she's like, no. She was like, no, you just have to, get your annual checkups and just, keep doing that. But like, you won't know until you try to have a child. But this lady was talking about womb health, how to get your womb prepared for having a child. So I don't know. I just wanted to bring that up because I feel like these conversations need to be a little bit more creative and like outside the box to get people engaged. That's just a comment I have.
Yeah, so we actually have quite a few of our healers here who do work with women health. And I think that we
I'm just saying, they all up there.
they all they're like here's my issue. Historically, the people who delve into spirituality, the practitioners who do the energetic work, are not always seen on the same playing field compared to the medical professionals. But the reality is, there are a number of people. I've even worked with women with womb health, and I've done baby blessing ceremonies and things like that, understanding that we are energetic beings first, and we are energetic beings inhabiting this physical body. And so a lot of that conversation, I think, is absent because of respect. But those three women over there are dynamic and have like healed a ton of women in the city and have assisted a ton of women in the city. And we need medical professionals who know that they exist to also advocate for them to be viewed as like equivalent or on the same playing field. We even had a conversation, or even higher. We even had a conversation with like the organization about the difference between a quote unquote medical doctor and someone that identifies as a doula or someone that specializes in womb health. And I was like, why is that not seen as something that is incredibly important to the development of the womb and like women in general and like birthing? And before there was modern medicine, there was them. Before it existed, it was them. And so like, how do we, and in our roles and responsibilities, how do we start to advocate and create spaces for our more naturopathic and holistic healers who specialize in that type of energy work to be seen? Because that's my issue. They're like, oh, they're just a midwife, they're just a doula, or they're just like, oh, cool, it's great that you have a doula. But it's like, do you understand how incredibly important a doula is and like what they do in assisting in that energy work? So I'll get off my soapbox, but I feel very passionate, and that's why I love these women so much, because when I call them healers, I even have to check some of the people like, what do you mean by healers? No, they're healers. Like, they may not have gone to medical school, but baby, they know the natural remedies, they know the herbs, they know the ceremonial aspects that can get a woman to feel good in her body or restored. Because oftentimes I've worked with a woman that has had womb trauma, and she was like, I went to the doctor, I went to the therapist, I need to get a reading. And so as a spiritualist, I was able to channel that energy to say, these are the things that we need to do to remove that trauma from your womb. So we have to start seeing us as, there are many streams that lead to the river, there are many rivers that lead to the ocean, there are many pathways to wellness.
I would also like to add two things. One, not only are they healers, they are purveyors. Right? They are literally cultivating life in all ways. Second, what you said is just so poignant. Oftentimes what I've seen, I could just speak from a personal perspective, Mama please, you don't go at it like that. I need to talk to this young person about, did they eat today? How's your relationship with your mom, with your dad? How's the relationship with yourself? How's the relationship with how you fit within society? Because if I come to you just to talk about syphilis, gonorrhea, trichomonas, and chlamydia, you are not going to listen to me. If I come to you and talk about HIV, you're not going to listen to me. But if I establish that trust and let you know that my questions are really about understanding who you are and being able to provide you with resources and support, I feel like oftentimes in public health, and I think HIV has been a great example of this, again, as a proxy, a lot can get done if we're not going just straight there. We have to look at the whole person. And oftentimes in health, we just look at the scenario. We do not take into account all the other things that are deeply impacting. And so I feel like for young people, it might be through a game, it might be through an activity. At Dillard, we were talking about, how do you create an opportunity to have an impact over time. Never like us having this event on the 27th is just going to be an event. But then what we're going to do to follow that up with, and then follow it up, and then follow it up. Because eventually when they start to see value in themselves, and Delise and I were talking about this earlier, when a young person or a person period sees value in themselves and sees their body as sacred, and this is something that they have to take care of, the world is their oyster. They're going to want to talk about it. They're going to want to feel empowered about it. So yeah, but no, I'll leave it to the queens. And I saw Mama Delise come over here like, thank you for bringing it up. Yeah.
I'll popcorn it to Kwame. Kwame had a question for the group, right?
Yeah, I did. So if you don't know already, I'm the founder, CEO of Bear Health, and our vision at Bear is actually to build a healthcare resource for the Black community that's free from the current healthcare system, right, and all of the racism that exists in it. And one of the questions that we ask people during our community design sessions, where we invite the Black community to in as equal partners in the design process of our solutions, the question that we ask is, what does ideal healthcare look like for you? We talk about all these things about what we don't like in the current healthcare system and what we wish it would be. Well, let's get clear on what that looks like. And so I'll preface it with this: in our app, we have 7 different categories: physical activity, mindfulness, sleep, mental well-being, physical health, nutrition, and self-control. Our vision is that people will be able to build their care teams in the app, be able to pick a provider in each category, and then be able to see that provider, whether it's virtually or in a clinic that is a one-stop shop for everything. So with that in mind, what does that experience look like for you?
I think I would like to see, and this is speaking from a student perspective, because when you think about students, you think about the next generation of leaders, right? So to prepare them to take care of them, it would look like universities taking the initiative to focus on student health. As students, I say that because a lot of times we're on go mode, like we're doing work, moving from class to class, trying to keep up with after school activities, other organizations, things like that, right? So when I think about universal care and the dynamics of it, I think about having access to that, just like we have access to go to the different restaurants on campus. Like, leave this clinic open to 8 o'clock. Why do my professors leave when my classes start? Not my professors, but why does my clinic close when my classes start? And what if I'm not getting to campus till 5 o'clock? And I know the mental health center closes at 5. So it's kind of like I'm racing against time to leave from work to get here to make this appointment, and it's not accessible. Same thing when it comes down to food, cafeteria, things like that. Like, if I'm not feeding my body and fueling my body to go, then everything starts to dwindle from there. And I say that too, because as a student, started off as bio pre-med, and I quickly learned that was not for me. So I clap it up and commend all of my bio students that are getting ready to graduate, because it's a tough cookie to crunch, right? And especially going to HBCU, adds layers and layers. So I think the first thing has to be prioritizing the people, and that looks like community organizations coming together, partnering, putting funds into a pot to have community days almost every week, if not twice a week, right? I think that's really what gets the mission out there. And then we have a lot of people that do work in these spaces to bring us together, like nonprofits, and then you got community health facilities like DePaul and St. Thomas, right? Why not collaborate on a larger scale to benefit the community in a holistic way, right? Because they can't do everything. They can't service everybody, but then you have healers like David, and you have healers like the different doulas and things in the room. Like, you guys can be of asset to people, but it's like, how do we start that conversation? Because yeah, it could cost something, but then it's people with the money. So who can fund it, right? So I don't know. I think of it as a lot of different moving parts, but starting off with, like, what can the community around us do? A lot of the organizations and institutions are larger in New Orleans, so like, we gotta look for them. Like, y'all producing Black doctors at Xavier. What are we doing for the community though? So I don't know. I look at it like that, but I get off my soapbox.
We gotta convince our Black doctors to stay here too. That's another thing. It's there's so many other perks and benefits and things, and it's not even just like with MDs, it's for psychology too and whatnot. Like it's just the ways that we get all of these experts to stay and hang around and whatnot. They have to figure out how to do that because we're undersourced, we're overworked. That's a part of the issue too. And so I think if I like in my vision of a greater health network and what we would have access to is that there are entities that are responsible for those things are doing the work to keep those people here and to help build stronger networks so that we aren't, like, oh, I have a caseload of like 20, 30, 40 people, some people. That doesn't make sense. How can you be a really great therapist when you have that many people to look after? That is absurd. And so I think that that's one thing. But the other part of it too is at the individual level, at the personal level, I would like to see that my networks are communicating with each other. So like that interdisciplinary work, my provider, my PCP talks to my gynecologist who talks to so you all are on the same page and it doesn't feel like I'm having the same conversation over with somebody because you don't know that I've already had this conversation over here. There's some kind of interdisciplinary work, so we are kind of more having a collective approach of how we help to treat you and help you get better. Because that, to the point of I had to go see this person, then a week later I got to go see this person, and to the point of with the doulas and the midwives and the doctors, that system, they shouldn't be, oh, you need to get out of the room. No, that person is a part of my care team. Are you communicating with them? Because whenever God gives me my little person, hopefully one day, I want the whole shebang. I want the midwife. I want the doula. I want everybody. And I want all y'all to be in the same room to have a conversation because it's important because you all bring something important to the room. So that communication piece is huge to me. It's necessary to me. So yeah.
Really, Kwame, to answer your question, for me, it would look like I want a phone call. I want some type of communication that is an invitation and an attestation that you have arrived. Like, this is where we want you to be. We welcome you. We look forward to having you with us. Because a lot of times that doesn't happen. It's just I think the assumption is that everyone wants it a certain way because we can have it that way. But some people will want an actual phone call. Like, hey, we're calling you from Dream House, health home, right? And we are here to welcome you. And Dr. David is going to meet with you. And literally when you walk in, there's a group of people waiting to receive you, right? To receive you, to be like, hey, we are so happy that you're here. Oftentimes you walk in and you get that whole kind of, but I feel like health is so indicative of how you feel. And how you feel is how people have made you feel. And so for me, it will be some type of personal touch. Are you open to a phone call? Are you open to a text? Are you open to someone showing up at your front door and saying, yeah.
I appreciate the language care team. So when I was talking about care team, I started to think about what's your care card? Do you have a card or a digital card, or maybe it's in your Bear Health app, there's a tab that you can click in. It's this is my care team. These are all the ways that I am supported in my health, from nutrition to prevention to treatment, and just this is my care team. I think we're so connected and so disconnected as people. And if you look around our city, I wonder how many people can say I have this stuff in a centralized place. From prevention to treatment. And I'm even looking at myself. I'm the amount of times I have to go through my emails, go through my computer, go to this provider, go to this provider, go to it just becomes a never-ending journey. It's almost like navigating the education system and the political system. So the healthcare system has to be working in the way that it was intended to work to create this chaos and confusion, because you actually end up shelling out a lot of unnecessary money. But if you had your care card or your care team and you're this is how I'm experiencing life, then you got that centralized access. It's I might need to go see a doula today, I might need to go do breath work. Or I might need to go talk to my therapist. I might need to do a combination of the three in order for me to facilitate my healing. I that's the thing that I would love to see. Like, how do we centralize the healthcare system so that it is truly a network that works for the people?
Perimenopausal right now, Kwame, and
Okay.
I just need somebody to talk about it.
Okay.
I don't need you to give me a pill. Can we talk about how my body is different than what it was 5 years ago? And I am mourning, and this is what mourning and grief looks like. I am the manifestation of not having a cycle, the manifestation of mental all of that, it would be having these three women like, okay, let's talk about how this is making you feel. Because oftentimes in healthcare, it's not universal, it's reactive.
And as you guys are thinking about your answers, remember that majority of health is determined outside of the clinic. Only 10% of health outcomes are driven by going to the doctor, right? The rest of it is your environment and your lifestyle. And so our vision really is to bring healthcare outside of the clinic into Dream House, into yoga studios, into just things that are actually driving health outcomes for everybody.
I think that health communication is a big part of just being healthy, because a lot of people are not able to digest like the things they may read online, even the things that their doctor is telling them at their appointments. So I feel like in these spaces, like even here, you could, what's the word? In these spaces, you can try to make that information more digestible. Like even the topic of not trusting the healthcare system, just breaking those pieces down for people so that they are able to understand on their own levels. I feel like it's super, super important. So how do we? No, I was just gonna say how do we do that even as healthcare provider doctors? Like, I went to the dentist yesterday, and she came in there, like did my exam for seconds and left and was like, yeah, she'll take care of you, but I want to talk to you. You're the dentist. Like, I want to talk to you. But I couldn't. And I get it. People have, caseloads and a lot of, overworked and all things like that. And I get that. I do. But it's just, how do we change all of that? How do we do that? And it's just, yeah.
I just wanted to add on to what you said in your question. Adding advocates or proxy folks to that list as well. It's not just medical folks. It's not just holistic healers. It is also advocates. Because, like, for myself, I can go to the doctor and be like, I have this question, and you're going to answer my question before I leave. But not everybody feels that empowered to do that, right? I also took a little class and learned how to advocate for other people when they're at the hospital with the doctor or whatever like that. So I think adding them to the list as well, that is making it a little bit more holistic.
It's part of the care team.
Yeah.
And you teach people how to advocate for
Advocates.
others.
Yeah.
I would say for me, communicating, comprehension, what you were saying in warmth, because with me, I honestly cannot stand sitting in the doctor's office. Like, I would call up a homegirl and be like, look, you already know where I'm at with this. I'm coming, girl. I'm like, I need that, because I be in the room and I be trying to sit there. Yeah, I probably wear more crystals that particular flow, that particular day, because I already know I'm gonna get smacked with all the energy in the room. Like, so that be my thing. It's like, I gotta walk in for me, but I'm feeling others. So they kind of put me in my little turtle in the shell, like, and you pull up. How does this work?
Yes.
So I had to, what you all are saying, like, it makes sense, because like it's moments where that is why I'm calling my homegirl, is because she's being the warmth in the room and grounding all of that I'm feeling. Because, I can go in there with a high vibrational mindset, speak to the person at the desk. I'm like, alright, so I'm gonna just chill, just let me know when you wanna call my name. And walk back to the seat quietly. So I would like the tension that's in the room. Like, I ain't gonna lie,
I asked somebody at one of them, I was like, cause she was playing some music on her phone. I was like, I had my Bluetooth with me. I was like, do y'all mind if I set a vibe up in here?
That's right.
Because like, it's hot.
It's giving stale
I'm
energy.
burned. Because everybody coming with their different energies, you know, out of their personal environments, and we coming in one room. So like, I don't know, put a salt lamp out on the table. You ain't even got to say, like, you know, something that will just automatically sop that up like a Southern biscuit and some syrup. Just sop it up, like, you know, just have that. I feel like that'll help everybody out, you know, everybody that's there.
I think it's part of our societal idea of doctors, lawyers, these people with these prestigious positions know more than we should know about ourselves. And that's why we get kind of either taken aback or feel overwhelmed by their presence, because we assume that they have gone to school and they have all of the answers to what we should, like what's going on with our care, when we can tell them what's going on with our care if we take a moment to connect with ourselves. But that's why you do need the holistic care, so that you can connect with yourself, and then you can tell the doctor something ain't right. But yeah.
Yeah, so I do doula work. I do doula work in the hospital, and also I do mainly more experienced in home births, right? And like my ideal healthcare system would be a system where we are no longer outsourcing our power to things that don't necessarily fully heal us. So as it relates to like maternal health and motherhood, the state of motherhood, the state of maternal health, there are many things that mothers don't necessarily know about their bodies, and they're entering into systems that are telling them that they are unable to do something that is scientifically proven that they can do without any interruption or any intervention. So my ideal healthcare system would be that we reclaim all the power that we have back to ourselves, to be able to listen to exactly what is happening within us, so that we don't go to the doctor looking for the answer. We go to the doctor with a question rather than looking for them to tell us, like, what's wrong with me? We already know what's wrong. We just need the prescription of how to get better, how to move better. And, you know, that holistic aspect of, you know, how to be well in this environment. I always take this quote from Sumi Patterson when she said, if we start to really believe that our wellness is an extension of the wellness of everyone around us, it truly will impact how we see health and healing. If I'm not feeling well today and I call my friend and my friend is like, girl, I'm not feeling well either, I'm like, okay, so we are connected. So how can we get back connected to really feeling what it feels like to be well? To slow down a little bit, just a little bit, to listen to what we need to do to move forward and progress to be healthy beings. Because our children need it. Our children are going to inherit a space, a place that is riddled with dis-ease. And I got a 6-year-old, and I'm like, I don't want that for you. All the children that I have brought into this realm, like assisted as a doula, like I don't want that for them. So, you know, yeah, healthcare looks like us taking into account what it looks like to reclaim all that back, pull all that back.
Think less about changing the current system, because I really don't think that's possible.
Yeah.
Right? That's going to be way too challenging, and I'm not even convinced that if we are able to change it, so to speak, that it'll still be as effective as it could be if we collectively created a system that prioritizes us. And so dream as big as you can.
Y'all, we rolled this conversation.
Yeah.
Thank you.
Sorry.
It just
beautiful.
I am so grateful for like all the energy that was deposited into not only the conversation but also into the space, and it just making me think about how important the work that we do in community healing, but also how important it means for us to expand and expose the work that we're doing. And when you were like giving your recommendations, I was like, oh, Dreamhouse, we have not had like a dedicated Wellness Wednesday to understanding STIs and HIV and like other diseases. We have not done that, and that's something that we could do. We also have not created the space to talk about like what does it mean for all of us to experience a form of wound care, regardless of your gender identity that you prescribe to. We all like have had some form of wound energy that we have interacted with just by passing through the Holy Grail. And so how do we, if you are experiencing some form of like trauma from birth, whether it's like you didn't feel like you was mothered properly, that's a part of wound care. And so being able to expand our understanding of this flow of energy, I am like accepting the charge. And I know that Dr. Baptiste be sitting down and creating the most amazing wellness calendar, but like just thank you for like pushing us to like dream even bigger in terms of like the type of experiences that we hold here. And maybe we do have to lead the charge of breaking down that barrier and talking about the things that are plaguing our community. Because we can't just be talking about like the healing or like encouraging people to go to therapy or encouraging people to go to the doctor without also creating that space for people to just like exist. Because I learned so much today, and I'm just like, I didn't even know nothing about no sexual network. But like, it got me. Yeah, but I'm grateful for it. Because had you not been here, I like literally ran back through my line of like memories of the networks that I have been associated with. Yes, exactly.
So when you were a CEO, as a CEO, you had a different sexual network.
Yeah, so I was just like, oh my God.
Y'all were doing you were just showing going and now,
yeah, but I'm grateful for it.
When you 40 under 40, that's a sexual network in and of itself. It's like I need my gonna be higher. Right? When I go to the NIH meeting or the NIMH meeting, I want to make sure.
Absolutely. The research conferences that we go to, like you ate it up. So I'm grateful.
And it's nothing wrong with it.
Yes.
But it's just acknowledging and knowing what it is. I'm gonna call Mama Delise and do some breath work real quick. For real, something to do real quick, because I know my energy says vulnerable, and I'm gonna latch on to anything that says hello.
Wow.
Sexual network already at the bar. Right? So knowing is half the battle.
Wow. No, I'm just like, Mike jump again. I'm like, wow. This is having
My mom didn't talk to me about the heat that can be in in us. I didn't have that talk.
Baby.
I had the talk of she heard me say sex, and I'm like, who said it? What that mean? Huh? Like I'm talking about stupid face. My face, I can't even mimic the face that I made. But I'm talking about dumbfounded. So, I just sat there with the dumbfounded look, and I, had her break it down to me when I already knew. And I was like, why did I sit through that? Because I was scared that she would go send me to the doctor and expose me through that way. Like, oh, okay, you ain't telling the truth. Well, you know what's coming. We're just gonna go this route. So she was like, and then she asked me again years later, because I think by then she was feeling the heat off me. But she was by then, I'm like, I needed a conversation, ma'am, about the heat. Like, like I feel like that's not taught from like mothers to daughters. Like that's a conversation that just don't happen. Like a chapter that's not there, but a chapter that needs to be written so that children are already doing the breath work and tantric, and they already harvesting. They ain't out here, you know, experiencing some cats and dogs.
Yeah.
That, you know, we laid out in life. They get the they get to skip past the, and that's skipping past a lot of trauma. You get to skip past the trauma of creating those soul ties that come with different all of that. Yeah, so it's like,
And she ain't fast.
yeah, and that's what I got stuck with. I'm like, oh, so I'm over here, I'm dancing and stuff, and I'm moving to fast. Like I'm like, okay, so I can't dance. What am I supposed to do with this? So now, who down the street?
Mm-hmm.
Right now?
Mm-hmm.
What's his name? Tony. Tony, what's up, Tony? I don't even like you like that, but this what TV showed me. So this how I'm supposed to connect with you. Like I was so masculine and confused. It's like my inner child was trying to walk me to connect with my divine feminine energy, but I let society and all my hood level movies.
Not the hood level.
All my hood.
I'm gonna say set it off. We can go through. We can We should have baby boy.
Yeah, I don't watch all of
Like
it.
I
Yeah.
literally had to play that out in my life.
Yeah.
Like nobody could tell me nothing. But it was toxic.
Yep.
You know, and it brought a lot of trauma. It
Yep.
brought a lot of shame
Yep.
inside me. It brought me being toxic to others. And I was like, okay, like I was like, we need to get that implemented to the children and get that implemented to like the parents to care about it more, because they be uncomfortable. They be so focused on it being uncomfortable for them that they don't even do it at all. And I'm like, it's not about you. So you would rather just see your child take the same experiences that you did, or you go get through that uncomfortable conversation, because it's just as uncomfortable for them too. So we're both healing here, you know. I don't know why it just channeled out of me, but
But that was for Dr. David to sit on, because I was just thinking, like, for summer that would be a beautiful institute to have.
I think we get to play. I think we get, like, that's my version. My version of play is liberation.
Yep.
And so I think we get to take all the energy in, whatever your role and responsibility is, whether you're in college or whether you're like a seasoned professional. I think we all bear the responsibility of leaving this space because we have brought this energy into the space. And so I know for me, I am deep in thought and will ask my friend to share these copious notes that she's taking because it makes me think about, like, so what now? And you mentioned that earlier, like, we don't want to just have these community healing events and be like, oh, cute, we did a community healing event. The purpose of this is to start to, like, channel energy that turns into action. And so I'm thinking about, like, what more do we need to do at our Wellness Wednesdays? Thank you for the great idea. Maybe we're launching a summer institute for kids to help them understand their bodies. And I'm like, also, where's the conscious conversation about the toxic ass movies that we watched growing up? And how that impacted and informed Let you watch one more, then we can talk. I'm like, cause I watch some crazy shit. Waiting to Exhale, Baby Boy, Loving Basketball, like.
Look, you listed all three that came to my mind.
And
In addition to Lady Sings the Blues. People forget about Lady Sings the Blues back in the day.
Well, can we go ahead and add that we already have?
Ease Bayou?
Yes.
Yeah.
We already have a in harmony.
Oh, yeah.
Yeah, so it's Wombs in Harmony that's coming up on the 24th. It's next Saturday from 11 to 3. And it is talking about those kind of things, like what kind of things do you get to do get to heal through before you want to conceive. And it could be to conceive a child or an idea, because that safe space is where you bring children forth, you also bring creative ideas from. So we will have the breath work, we will have our meditation as well, we will have discussion. We will connect with whatever trauma you may be holding on to. We will create an altar to let it go. There will be food and celebration at the same time, but it is sometimes it can be very heavy work, but understanding that we have the people and the resources and the connections here to be able to support you through that process. Yes.
Can you close us out with a breathwork activity?
Here too? 'Cause,
Yeah.
You know, I was about to, am I not doing the class? Or
Well, I mean,
we a little late.
Well,
Okay.
yeah, we had enrolled into. So I was like, okay, thank you. Shout out again for Dr. Baptiste. So we got Dr. Baptiste.
Thank you.
Like rolling too.
Okay.
Like, do a little